Good morning. So excited to be with Stefanie Ferreri this morning. We tried so hard, Stefanie, to get together at last year's Medipreneurs, but the calendar didn't work. So we are thrilled to have you joining us this year.
I'm excited to be with you, Michelle. Thanks for the invitation again.
You're welcome. And the reason you are someone who absolutely needs to be here is you've created new things over and over again. Can you give us a summary of all your intra and entrepreneurial activities?
Sure. So I think that that's something that really excited me about pharmacy is I like to try new things, and it really started in my residency, I would say, where I was a risk taker, and it was a low stakes at that time that you could try new business ventures, you could try new clinical services in community pharmacy, and my passion really began with I loved AmCare. However, it was difficult at the time to get an ambulatory care position, so I wanted to bring that ambulatory care feel to community pharmacy, so that people could walk into their hometown community pharmacy and be able to get clinical services that we as pharmacists learn in school and that we can provide. So there's been several things that I've done throughout the years. I've started new diabetes services where we brought diabetic shoe fitting, blood glucose monitoring, and diabetes education. So diabetes is a real hot topic right now with diabetes prevention services from the CDC, or if you want to go with the American Diabetes Association accredited program, that's another one. So diabetes is a great opportunity for community pharmacists. Others that we've done are immunizations, and immunizations is fantastic because there's a revenue stream that's associated with immunizations. And so I tend to think about, what can bring revenue to a pharmacy versus what are more risky that might not bring revenue. So if you're not sure where to go, immunizations is a fantastic one to start because once you get going, it will bring in revenue and it's easy to incorporate into your workflow. So I think that's another great one. And just a couple others, Michelle, and then you can sort of decide if you want me to go into it a little bit more. Pharmacogenomics is another one that we've initiated within community pharmacy. One was a little more challenging, however, it can be done. But pharmacogenomics is one. Medication therapy management, honestly, that is where all pharmacists should be starting, since that's our bread and butter. We should be the one medication management experts, and really using our medication expertise and working with the members of the team, so the physicians, the nurse practitioners, the PAs, the nurse care managers, and social workers for those patients to make sure that they're being taken care of, and we really focus on the medicine. So medication therapy management is another big one that has been a mainstay of my career for a very long time.
Oh, you have such a mover and a shaker. And you have really set the standard on so many innovative things within community pharmacy, which is one of the most exciting parts of you joining us at Medipreneurs. Tell us a little bit, let me orient people first. If they're familiar with the Medipreneur agenda, we start on Saturday with the keynote address, and then we give people options. The next workshop on Saturday is all about really setting the stage of where you want to go with your practice or with your business, and that will help you then pick what tracks you take later in the summit. And so on that second time slot on Saturday, one option will be you for people that have any sort of thing that they want to do within their community pharmacy setting. So can you tell us a little bit about your workshop and what that might be like?
Sure. So I think the people who should come to my session are those who have worked in community pharmacy, and maybe those who are looking for something a little bit different, that maybe they've been a traditional community pharmacist focused on dispensing. Maybe the corporation has been focused on volume and making them churn out the prescriptions. However, we're in a pivotal time point right now in pharmacy career where we're shifting from volume-based practice, which a lot of us have been trained to do, to value-based practice. And that value-based practice is a definite business and culture and mind shift within the pharmacy profession. So figuring out how community pharmacy can fit into that value-based care model and how to change your business or how to be an influencer and influence those above you, or if you are the owner, how to get those below you, your employees, to sort of change that mind shift. So I'm going to focus a lot on value-based care and the shift from volume to value-based care and how a lot of these entrepreneurial services align with that value-based care so that community pharmacists will be relevant in the future when volume goes away.
Absolutely. And we hear daily about shifts in the more traditional pharmacy roles? What are you hearing, and how might people be feeling about their jobs right now? And how might Medipreneurs in your session be just what they need to feel good about pharmacy again?
Yeah, I think, there's sort of two ways to look at pharmacy. I think you have the pessimists who are like, oh, it's not going to be the same. What's going to happen? My job's going to go away. It's going to be taken over by robots and ATMs. And I hear that part of it. But then I also hear the other side, that great opportunity, that this is a way for pharmacists to get involved in their profession in a way that they've never been involved before, and really use their clinical training, their medication optimization or medication therapy management skills to be part of a team, which has traditionally been hard in a community pharmacy when you're not in the same location to have that team-based care. Physicians are feeling just as much pressure as we are as far as this value-based model, and they're trying to figure out as well. So we are a great resource to them, and sometimes they don't know that, and we have to use our relationship skills. We're really good at that. Those who work in community pharmacies, we love our patients. We want to know about their families. I don't think physicians always realize that we have a ton of information that they might not have. So I'm going to focus on also how to develop those team-based care relationships when you might not always be working side by side with the other healthcare providers who are also taking care of your patients who come to your community pharmacy.
That's a great point, because a part of what we do is we actually make their job easier and their patients' outcomes better.
Yes.
And so learning and understanding how to build those bridges makes a lot of sense for what the future looks like.
And I think it's really focusing on cooperation rather than competition. I think sometimes the physicians, again, go back to my immunizations. When I first started immunizations, a lot of physicians viewed it as competition. And a lot of nurses, said you were taking away our business because they would come into the pharmacies. However, fast forward 2-3 years later, we were getting referrals from nurses, getting referrals from physicians. And they saw that it was more about cooperation and really helping, making sure that their patients were immunized and that we were getting more patients to be immunized. And so it really helped with their metrics, even though at that time they were not being measured on metrics, but now we are being measured on metrics. So that, I think, is, again, how do we as pharmacists market ourselves as we are cooperating with them rather than competing with them?
Absolutely. That is a great point.
Mm-hmm.
We cannot wait to see you. If you are in community pharmacy in any facet, this is going to be a workshop that you do not want to miss, and the kind of thing you're not going to find elsewhere. So thank you, Stefanie. We can't wait to see you in April, and by then winter will be gone. It'll be spring.
I'm looking forward to seeing Asheville in the spring. It'll be fantastic.
It'll be beautiful. All right. Take care. Thanks so much.
Thanks, Michelle.
Bye.